This is a new program that we've started at Memorial Hospital, and what Enhanced Recovery After Surgery is basically a program that was started over in Europe and has come over to the United States and gained quite a bit of momentum. And what it is it's a multimodal program that looks at the entire perioperative phase, so from when the patient starts in the office to they completely recovered, and basically looks at all those factors and addresses all those to help the patient through the process. So it's really any colon surgery. The most common things that we treat are going to be probably diverticulitis, colon cancer, or some sort of colon polyp will be the most common things that we would see. Some of the benefits of that are shorter length of stay, less complications, patient satisfaction. So what it does is it takes evidence-based medicine and applies it to the things we've been doing for years and years, and does it as the entire picture. Right now it just applies to colon and rectal surgery, and basically we've broken it down into 3 phases: preoperative phase, intraoperative, and postoperative. The preoperative phase, there are several important things there, and some of the big changes are we're now letting patients drink liquids up into a couple hours before surgery, where it used to be nothing after midnight. We are giving them carbohydrate drinks ahead of time, which has been shown to decrease nausea, vomiting, decrease the stress of surgery. Really focusing on patient education. We've created a patient education booklet that I start with in the office and explain to the patients what this program's about, and it really goes through the different phases with the patient as well, as far as what's going to happen before surgery, right after surgery, and the recovery period. And then we also are focusing more on, and we've been doing this, but focusing more on smoking cessation, alcohol cessation. If the patients need some preoperative physical therapy, if it's something we can put off and do that, we'll do that as well. So that really covers the preoperative phase. Intraoperatively, really trying to focus more on doing minimally invasive surgery, using less narcotics during the surgery, and also anesthesia is working with us to direct the fluid replacement based on specific parameters there. In the old days we just dumped lots of fluids in, and now we're really focusing on what the patient needs, and found that helps with the recovery as well. In the postoperative phase, some of the big things there are early ambulation. So we are getting these patients out of bed almost as soon as they get to the floor. So they're gonna, if their surgery is done by 2 o'clock, they're gonna be up and they're out of bed twice that day. We're starting on diets sooner, so a lot of these patients are starting up with clear liquids when they get out of the recovery room to their floors. We're really focusing on a patient care plan, and they've created a care map so the patients can really understand what's going to happen on day 1, day 2, day 3 until they go home, and then tying it up with the recovery and the follow-up in the office. So it really looks at the entire process from the beginning to the end, and the studies out there have really shown that it is quite a benefit to the patients. This involves a lot of different specialties. So from a physician standpoint, you've got your anesthesiologist. We also work closely with either the primary care physicians or the hospitalist if the primary care physician doesn't come to the hospital. We have pharmacy, who's been very involved with this. Obviously nursing plays a huge role in this. Physical therapy, dietary, they all have a big role in putting this together.